Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is 24th August 2025. This video is on a European Heart Journal article published on 9th August 2025 titled LDL cholesterol and cardiovascular risk in the absence of calcifications on computed CT, the Western Denmark Heart Registry. LDL cholesterol is a key driver of atherosclerotic plaque formation beginning early in life. Coronary artery calcium scoring is used to guide risk stratification and therapeutic decisions. A coronary artery calcium score of 0 is often considered reassuring and may lead to de-escalation of lipid-lowering therapy. However, younger individuals often harbor non-calcified plaques undetectable on coronary artery calcium scanning, raising concerns about long-term risk if LDL cholesterol is left untreated. Recent evidence suggests that coronary artery calcium equivalent to 0 does not equate at no risk, especially in younger adults with elevated LDL cholesterol. The study aimed to assess the association between LDL cholesterol and the presence of non-calcified plaque and incident coronary artery disease events in individuals with a coronary artery calcium score of 0. They used the data cohort comprised of 23,777 symptomatic individuals above the age of 18 with a coronary artery calcium score of 0 undergoing coronary CT angiography. This was from Western Denmark Heart Registry between 2008 and 2021, a population-based registry covering 55% of Denmark. There's about around 3.2 million residents. Exclusions: patients with prior CABG, heart failure indications, or missing LDL cholesterol or coronary artery calcium data. LDL cholesterol assessment was values obtained from routine lab databases. Statin use was identified via prescription registry. Statin use was defined as redemption within 180 days. Coronary computed tomography angiography CCTA included non-contrast coronary artery calcium scoring and contrast-enhanced plaque characterization. Plaques were characterized as non-obstructive when less than 50% stenosis or obstructive when greater than 50% stenosis. Statistical analysis: logistic regression for non-calcified plaque, adjusted odds ratio, Cox proportional hazard models for CHD outcomes, adjusted hazard ratios with age stratified spline modeling was used. Covariates included gender, smoking, hypertension, diabetes, Charlson comorbidity index, and prior statin use. What did they find? Results for all per 1 millimole per liter increase in LDL cholesterol. Adjusted odds ratio for non-calcified plaque was 1.21. Adjusted hazard ratio for coronary artery disease was 1.28, 95% confidence interval, 1.13 to 1.46. Strongest associations in the age below 45. Adjusted odds ratio was 1.39 and adjusted hazard ratio was 1.37. Coronary artery disease 5-year cumulative incidence 0.79%, low absolute but relevant lifetime risk. Limitations of the study: observational design, possible residual confounding. Coronary artery calcium equals 0 may miss early stage non-calcified plaques. Events may arise from undetected or de novo atherosclerosis. Key takeaway: LDL cholesterol is associated with CHD risk even in the absence of coronary artery calcium. Coronary artery calcium score 0 is not a free pass, especially for younger adults. Lifetime LDL cholesterol exposure matters. Early intervention, diet, lifestyle, pharmacotherapy should be considered in high LDL cholesterol individuals regardless of coronary artery calcium score. Eponyms and legacy figures in atherosclerosis. Friedrich Wöhler, 1800 to 1882, first synthesized cholesterol in vitro. Anichkov and Charlotte in 1913 demonstrated cholesterol-induced atherosclerosis in rabbits. Rudolf Virchow in 1821 to 1902 described atherosclerosis as a chronic inflammatory process. Axton score, Arthur Agatston, 1990. Eponymous method for quantifying coronary artery calcium via CT. Michael Brown and Joseph Goldstein, Nobel laureates, 1985, for describing LDL receptor pathway and the pathophysiology of familial hypercholesterolemia. Akira Endo, Japanese scientist, discovered myostatin in the 70s, foundation of statin therapy, though not a Nobel recipient, widely considered deserving. John Goffman developed ultracentrifugation technique to isolate LDL cholesterol linking into coronary artery disease. Jeffrey Rose, 1926 to 1923, advocated population-based prevention of cardiovascular disease through risk factor modification. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.